to wait for the other. Well, hi, good evening, everybody. Welcome to the Health and Human Services Council Committee meeting. Today is June 5th, 2024. We are here in council chambers. The public's more than welcome to join for our council committee meetings. However, we do not accept public comment at the meetings, but you can always email council at everettwa.gov or give us a call on our landline. Tonight we just have one agenda item. We'll be receiving a community development update briefing from Julie Willie, share about all the good things going on in our community development department and good stuff coming down the pike as well. So Julie, if you want to take it away, go ahead.
Good evening. Thank you for having me. And so I have just a variety of miscellaneous updates, and they're in no particular order. And so I was thinking I'll go through them, I'll pause if you have specific questions, then we can kind of move on to the next topic if that works. Okay, so first is regarding the Everett Gospel Mission, and tonight there'll be a consent agenda item on your council agenda for the acceptance of pass-through funds to pay for the operations of the Palisades Shelter community. This is the second round of funding that we've gotten for this from the Washington State Department of Commerce Emergency Housing Fund, and it covers expenses that were incurred from last July 1st through the end of June. So it's just taken a bit of time for the contract to make its way over from the county. So pretty standard, but I just kind of wanted to let you know that there is no formal briefing on it, and
yes. So that's the current pallet shelter.
The current pallet
shelter.
Okay. Yep.
Great.
Yep. And so then also about EGM, the city and the county are currently going back and forth and finalizing the interlocal agreement that will allow us to transfer the $4 million that's been allocated to new congregate shelter in Everett. And I believe John Hull shared with you last month that they have huge desire to purchase the Atlas property right next to their current site on Smith Avenue. And so we're working as quickly as we possibly can to get that ILA in place so that they don't lose their opportunity to purchase that site. And so it will hopefully be here within the next 30 days, and that's something also that will come to you as a council. So that will also, just to kind of refresh our memory, relocate those that are living at the UCC shelter, provide a little bit more capacity, and then be a permanent location for emergency cold weather or inclement weather sheltering. So that's about EGM. Questions?
I know that he talked about how the church had sold and was going to be redeveloped. So what is the timeline on that?
Yeah, so Housing Hope has purchased that site. They are right now in the process of kind of getting their fundings organized, through state, through county, through, the different tax incentives and things that they can do. Our staff just met with them last week to learn a little bit more about all of those things, and I don't exactly know, it will be several months before anything will happen with that site, but we can ask Housing Hope for a little bit more detail so that you can have a better timeline of when that will happen. Our understanding, it will be for 65 seniors, I believe, when it's all said and done.
So it just, they are coordinating with the gospel mission so that UCU won't close before anybody can move into the expanded facility.
Yeah, I mean, they've been really, really generous in wanting to make sure that there's no displacement, and certainly if there is, I think we'll all have to work on a plan for what that might look like.
Yeah, okay,
Yeah.
Great, thanks.
So we continue to be optimistic, because that's all we've got, for a positive ruling from the hearing examiner's decision on whether the VOA Women and Children's Pallet Community Temporary Shelter can move forward at the CMEX location. The decision is expected from the hearing examiner tomorrow, June 6th. And should the ruling be in favor of the Friends for Phil Johnson Ballfield, who opposed the site being used for temporary high barrier shelter for women and children, we are committed to trying to find an alternate location. So not getting ahead of ourselves, because we really do think it's an appropriate location. We feel like we followed all of the rules. It's temporary. There's no permanent structures, but we know it's an important need. So if the hearing examiner agrees with the Friends of the Ball Field, it won't stop us. So that's an update on that.
And happy to support placement moving forward if
Thank you.
Whatever happens. So
yeah. Again, we don't want to put the cart before the horse, but we also know that it's very important. We've already made purchases of the pallets and some of the other outbuildings, and Volunteers of America is a strong partner that has a strong program, so it really is important to us.
Great. And this is the program that's for women who are in recovery and their children?
Yeah,
Okay.
yeah,
Just wanted to say that out loud. Thanks.
yeah, yeah. With barriers, goals, rules, a lot of, expectations for behavior and such, so. All right, so let's see, community support. Our community support team are currently working Monday through Saturday alongside of our police, fire, and library departments. Each month, that team engages with about 250 individuals, several of them multiple times a month. And they're being deployed, of course, out alongside of our police department or working with them on special outreach activities. They're being referred by our fire and EMS to residents who may need social services and behavioral health supports. And they're meeting with individuals who are either hanging out at our libraries or come to the library to seek support services, either being referred by other city staff team members or community partners, or working to navigate through the challenges and connect them to community-based partners and services. So that's kind of the status of our current community support team. But as you may recall, we were granted $4.5 million of non-competitive federal grant funds, thanks to Senator Patty Murray, to establish an alternative response program to better assist individuals experiencing behavioral health and mental health crises. The funds are being administered by SAMHSA, and the application is due on June 21st. When we requested these funds about, two and a half, 3 years ago, seems like forever, we anticipated that it would cover 3 years of establishing a program, and we thought that that would really give us an opportunity to develop a sustainable program and determine all of the other factors that are in the world right now around developing alternative response programs. However, SAMHSA requires a 1-year grant period. So with a with a possibility, and it sounds like a pretty good possibility, that there'll be an extension for a second year. So it kind of changed our focus, needless to say. So, go ahead, Judy.
So does that mean you have to spend the $4.5 million in 1 year?
Essentially.
Okay.
Well, we are working with our lobbyists to see if, hopefully with a letter from Senator Murray, that will be really compelling to SAMHSA to ask them for an extension. But at this point, Julie's team really has to operate under the assumption that we gotta have the momentum to spend it all in 1 year, so.
And the way we're building it, I believe, it really is kind of set out to do a couple, I should just read my notes and not go off script, but really create a foundation, start implementing the program so that if we do have to go back, they're going to say, oh, well, of course we're going to extend it for a second year because you have this great foundation. You've only been able to do this for 3 months so far. We want to be, it will be a 6 month by the time that the program ends. So I feel optimistic, and the program manager that we've met with and is working with us from SAMHSA, it felt optimistic. So to take advantage of both the funding opportunity and to build on the learning and success of our current support team, SAMHSA has confirmed that we'll be able to kind of restructure our multi-department embedded social worker model into more of one unified team. This will increase our capacity for responding to those behavioral health crises more hours a day and provide more specialized responses on our team. We will still be deeply embedded with the police and fire and library, but we also believe we'll be able to expand to assist our other city departments and possibly take community-based referrals. In addition, we hope to build a pilot partnership that will allow for after-hour crisis response. So rather than us trying to add 24/7 to work with VOA and 988 to kind of use their structure that they already have in place and pay for a contract with them to be able to offer that service. To continue to do our case management, we currently have a contract with Bridgeways that provides kind of ongoing case management, so to continue a case management program. To develop some type of ability to provide competency diversion for those individuals that are kind of stuck in limbo when the courts don't, can't necessarily help them, and the state system isn't in place to really help them get quickly into assessments with Washington State our western state and such. So they just end up kind of going through revolving doors. And so how to better help, those individuals. And then also try to figure out how to increase our transportation, because oftentimes we hear that that's such a barrier for individuals that either want to go to a treatment or detox facility that isn't near us, or they want to return to their community or what have you, or just need to go to a local appointment and don't have transportation. So the new structure will essentially have a three-pronged approach that will include crisis response, so, the fire and the police and the 911 kind of situations, a care coordination prong for that navigation, case management, and treatment referrals and such. And that, of course, is intended to help decrease our call volumes through police and fire and our, lessen our jail and hospital stays as well. So the other piece that we're trying to make sure that we incorporate is like the medical piece of it. So our remote program, making sure that we have a way for individuals to get access to behavioral health treatment, to substance use treatment, to medical care. We won't need to use this funding for the remote program, but we still see it as an important piece of that kind of new model. So I think that the funding will allow us time to kind of determine what exactly Everett needs regarding alternative response, while we're working with both like our state and our regional and our local partners as new behavioral health policies and programs are developed. And this includes collaborations with our local nonprofits, the VOA and 988, Snohomish County 911, our local healthcare authority, and our North Sound Behavioral Health Administration Service Organization, all who are in various phases of this work. We're just kind of a little bit more ready, than, we got to just figure it out as a region, but we have this opportunity to do it. In preparation for what's to come, we're making a couple of changes right now, including working with Everett PD to expand the behavioral health supports further into the police department. So rather than just kind of being embedded with the COET team, we're going to work to support patrol and be more available for certain types of behavioral health calls, or to be referred after a situation is deemed safe, but it would really be beneficial to bring in a behavioral health response. And it's been a long time coming. Like, we've kind of always recognized that co-ed is different now than when we started, because we have a lot of other outreach and lead and host and other programs in our community that also serve this need. And so to me, it's really excited that we have this opportunity to pilot this a little bit, so that then when we get to this new alternative response, the culture is already ready for it. And sometimes when you work with big systems, changing that culture, getting them to do things differently are hard. So this kind of gives us an early launch pad for doing that. And the second thing is another grant that will be coming to you. We just found out that we will be getting about $58,000 from AWC, Association for Washington Cities, and that's going to enable us to kind of launch a field supervisor position, because again, these people are working day in and day out, 250 individuals per month. So to have somebody that can be a little bit more of a clinical supervisor and can step in and help when things are hard or they don't know exactly what to do. And our current manager does an exceptional job, but she got a really big job now with all of these other things. And so having a more in the field supervisor, I think, is going to be really beneficial, and it's absolutely going to be something that we'll need when we expand with the alternative response team.
Awesome. So yeah, I'm glad to hear about the alternative response and the potential for follow-up. I had gone on a police ride along not too long ago, and the first call that we went on was an overdose call, and I was watching the person get revived, and they did, which was wonderful. But then I couldn't help but wonder, like, what next? Like he was talking to the paramedics about how he lives down the street, he doesn't live too far from there, and so we left before the situation concluded. But I was wondering, what happens to that person? Do people just walk away and leave him by the dumpster? Like, does he get a pamphlet? So I'm glad to hear that there can be a situation where a team can show up and stay for a little bit longer and, really work with the person to make sure that they have a good pathway forward after a situation like that. So just that continuum of care and compassion, I think, is really awesome. So I'm glad to hear that.
And certainly the last year of having social workers embedded in the fire department has kind of reiterated that need. And so in that situation, what could have happened is the paramedics could have gone back and done a referral for our social workers to then go back and kind of knock on the door, give a call, and offer some support, offer Narcan leave behind. So those things also are happening today, but this will certainly strengthen that. And then also having a moat where we'll be able to call a moat. Maybe if, they have their peer support counselors out, that they could also be available to reach out and to connect with that person. Another, the fire department, again, and not to speak for Chief DeMarco, but, they're working on the buprenorphine protocols to try and be able to also not just revive people with Narcan, but then also give them an opportunity for a stabilizing substance use disorder medication, so that they can then maybe make a next step to detox or treatment or other services. So there's a lot of things going on in this space that hopefully then will help the person that you're thinking about.
Great. Yeah, and another, when we were in the car and, there's the dashboard or the computer dashboard of all the calls coming through, it was clear that quite a few of those calls didn't need a police officer. It was more a dispute resolution type of thing where there's, two folks that are maybe getting in a frustrating situation, but a police officer doesn't need to show up. So I'm hopeful that a program like this can maybe the police officers can designate certain calls as needing more of a caring person that can stay for a longer period of time to be a mediator, and then to free up the police officers for emergency calls. So hopefully that can be included at some point too.
And that's exactly kind of why we want to start expanding beyond just co-ed, so that police officers can get used to either hey, we know already this person or this call type should have a social worker go alongside of us, or they might drive separately but arrive at the same time, or they get there and then they immediately realize okay, there's no criminal behavior, it's a safe situation, I want to refer out our social worker team to provide that kind of support. So you're spot on.
Great. And then you had mentioned that there might be an opportunity for community-based referrals, and I was hoping you could expand on what that means.
Well, again, a moat, for example, is a community provider. So if they come across somebody that okay, I can give you a telehealth appointment, I can connect you to social services, but hey, I know the library social worker has a great contact through the diversion center, or something like that, that we might be able to do that. I don't think we're, again, we can't bite off too much, because I don't want to start something and then, oh, I'm sorry, a year later we're not able to continue it, so we have to be kind of mindful about how big we go and how much we create. So it's not yet going to be something where, I don't think yet it will be something where, residents can call and say, hey, I want this to be deployed, but that's absolutely what we're trying for, right? So when you call 911 because of a behavioral health challenge that someone's having, that we have a robust team that we will be able to eventually deploy. So this is kind of setting the groundwork for it, or maybe a phase one for that future work of what a true alternative response team looks like.
Great. Councilor Dewey?
Yeah, I had a quick question. So kind of run through, Julie, what we expect when, say, I know there's probably 3 folks that are living on the streets in the downtown. They don't seem to be on drugs or anything. They probably, I'm sure, have some mental health issues just being on the streets. But, they've been there a very long time and they're there constantly. What do we do with them? How do we help them get off the street?
Well, some of the individuals that you're referring to are those people that are living in limbo, where and again, I might need to call Flora up, but, the judicial system deems someone to be incompetent, and then therefore they're not able to stand trial. And so then therefore, and again, you go ahead and go, and then I'll give my further commentary.
Sure. We do have several individuals who are not competent under the law, meaning they aren't able to understand the nature of the charges against them, or assist in their own defense if they have a criminal case brought. And a lot of times people who have mental health issues and live on the streets might have cases like trespassing, especially if they're mentally incompetent and might not understand what's going on. However, unless they commit certain offenses that the legislature has deemed as serious offenses, like assault, DUI, that sort of thing, they can't be ordered to have competency restoration treatment. So on the criminal side of things, they might get arrested if they committed a crime, but unless it's a serious offense, and they might get evaluated by a doctor, and the doctor says, yep, this person isn't competent for the criminal case to proceed, their case has to be dismissed unless it's a serious offense. And at that point, they can't go into like our mental health court, MAP, they can't do therapeutic services court because they aren't mentally competent for their criminal case to proceed. And so they can't opt into those sorts of programs. And if it is a serious offense, there's a long wait time still for any out of custody cases, like all of our misdemeanors, for competency restoration treatment at Western State Hospital. So even if they do have a serious offense, like an assault as one of their charges, they're waiting a very long time to actually get treatment. And so the idea with doing a competency diversion, and this is on the criminal cases, would be to refer these individuals who are, they're not unwell enough to qualify for civil commitment, to be civilly committed under RCW 7105. So they usually get evaluated by DCR before the judge decides, yes, this is a serious offense and we're going to order competency restoration treatment. So they're not unwell enough to be civilly committed, but they're not well enough to opt into something like mental health court. And so we want the competency diversion option in order to have them engage in some way with mental health services, substance use services if they need them, and then other social services like housing assistance. And the idea is to have a 6-month program. And then the criminal case would be dismissed at that point if they, again, engage to the extent that they could be expected to. They have to be willing to get help, but they obviously wouldn't be held to the same standard as somebody who's mentally competent in a criminal case. And so that's the limbo, is somebody they're not unwell enough to be civilly committed, and they're not well enough for the criminal case to proceed or do normal probation or do MAP or TSC. So, and a lot of people, if it's a trespass case and if they aren't committing a violent offense, it's not a restorable offense, and it's just, we can't proceed under the law. And if they're not unwell enough to be civilly committed, they're also sort of in that limbo area where they might be arrested, but they're right back out the next day because we know they're not competent and we can't proceed on their case.
And those individuals have been offered many services, shelter opportunities to be somewhere else, and we can't force them. The laws don't allow us to physically restrain them. Police can't, touch them. There's a lot of restrictions based on the laws that nobody can help them.
But I mean, it's not completely hopeless though. We have somebody who wasn't competent for a long time, and he actually worked with Host and was able to stabilize and I think take his medications as well, and has gone back into being mentally competent on his other cases. So I hope that he will go into mental health court, into MAP. That'll be up to him whether he does that on his cases. So luckily with something like competency, it is usually something can be restored. Usually it needs psychiatric medication though in order to be restored.
And another scenario in that is if the individual then did something criminal, I mean, not to say that that's what's going to happen, but then he could or she could be charged with a criminal case, and then that potentially could lead to a different path, like maybe 30 days in jail where they might get opportunities for their medication to be restored or opportunities for stability, living in shelter, whatever it might, behavioral health supports that might help them in the long run. So,
right. But only somebody who's competent can plead guilty or go to trial and get sentenced. So, and I am talking for all the competency cases, these are all criminal cases, even though they're misdemeanors, they're not felonies, those are up to the county. But when I'm referring to competency diversion, those are all some sort of criminal cases.
And when the new Compass facility opens, that'll help fill some of this gap too, right?
Well, we'll have triage available again, which is something that we don't have easy access to, so that there is a place to take them for 72 hours to help them, to assess what their needs are and things like that. And then, but the laws or the rules around crisis stabilization and things like that, I'm not an expert on that by any means, but that also I think is something that a judge mandates you to attend or something like that. Some of those more secured facilities, so.
I think that's probably civil commitment, so that's where somebody has to be an imminent danger to themselves or others. And that could also be if it's called gravely disabled, meaning they can't feed themselves, they can't take care of, they might, the danger to themselves is that they might just starve or otherwise be unable to care for themselves. But that's on the civil commitment side of things. There doesn't have to be any sort of criminal behavior if they're unwell to that point.
But a judge would still be the way to that pathway.
The DCR, the designated crisis responder, can make the initial detention for up to 5 days. But after that, any further commitment has to be reviewed, and that's taken care of in Superior Court.
It's very complicated.
So how do we,
Unless you're Flora.
so how do we make sure people don't get to that point? Like, where's the early intervention to make sure that they don't get to a point where they're gravely disabled and can't even feed themselves? And I mean, I know we've all seen a person or three on the streets that are in pretty dire situations, and that didn't happen overnight.
Sure. I mean, the county DCR has a 24/7 crisis phone number that anybody can call, and so the police will call them to see if somebody should be civilly committed in some cases. And so there might not be criminal behavior, but anybody, if it's their brother and they're really worried about them and they think they might need to be civilly committed, they can call the county DCR to come look at them. But we have seen, again, anecdotally in some of my criminal cases, is people sometimes develop brain damage through long-term substance use, especially methamphetamine. And once your brain has been damaged to the point where you're not competent because of that, we can't fix brain damage. Like, we as humans and doctors in the world, they can't fix it at that point. And so I think substance use prevention and substance use treatment assistance can help stem the flow of people who deteriorate to the point of having cognitive issues that arise from long-term drug use.
Yeah, I mean, it's also like if we had the VOA 988 people that have been doing this kind of crisis response, they would talk to you about the history of what brought us here. And there are things that happened within, state law and changes of programming and things that communities then were responsible for that we weren't ready for, and again, even when you ask me that, I'm like, how much of it ends up being a municipality's responsibility? Like, are we responsible for the mental health, behavioral health challenges and needs of all people? Like, it's just such a philosophical conversation as well. So,
Yeah, I wasn't expecting a
No.
three-pronged
Yeah.
approach to,
Yeah,
tonight on that.
Civil
Well,
commitment is for
yeah.
the county Superior Court to make decisions on. We can refer people for a DCR to evaluate them, but the ultimate decision and the court decisions, those are all on the county level.
Yeah, I mean, and the systemic unravelings have been happening for decades, so to weave that back together will
Yeah.
take generations as well, so.
yeah. But I mean, again, I think some of the work that we're doing is optimistic and is potentially, even we just learned today that the state has, or not learned today, but we've come to learn that there are more opportunities for quicker assessment.
Yeah, well, the assessments are done on time. The sending somebody to Western City Hospital or another hospital for competency restoration treatment, that went down from a very long time to now it's about a week and a half. And so that's great. So if it is a serious enough offense, that's something where our judges might be able to then order that they remain in custody and get transported to Western State Hospital. That frankly hasn't been an option for a couple of years now. It was bad before COVID, and then it got way worse during COVID. And there's been a lot of litigation in federal district court against the state of Washington and DSHS due to the delays at Western State Hospital and Eastern State Hospital, and they've been working to improve that. And so this is sort of the fruits of that labor that we've heard just recently. And I think Governor Inslee sent out an update talking about it, and then I confirmed it with a county prosecutor that I know that yes, this is really true. So it is getting better on the state level, which will definitely help, what we see in the municipal level.
Great. What else you got, Julie?
Okay. So the Drug Crisis Task Force will conclude meeting on June 20th, at which point a final report with our recommendations will be provided. Publicly, I'd like to thank the members of that task force for taking the time to learn about the difficult circumstances regarding our current drug crisis, both better understanding the challenges for those experiencing the substance use disorder, and then also our city's public space and public safety challenges, as well as the barriers around solving the problem as a city when we have minimal resources and little ability to make local, state, federal changes that might be helpful. So I just kind of wanted to give you a heads up that there's more to come on that. Dr. Roby and team continue to move forward with the creation of our mobile outreach team called Emote. As with any new program, there are many processes to be put into place, and we've been meeting with them and continue to meet with them on a weekly basis to support their efforts and ensure that our city needs are met. To date, they've hired 2 peer support staff who will be in the field building relationships and being available to connect people to MAT and other mental health supports. And as we did receive funding from the state legislature, we have been asked, working with the Washington Healthcare Authority, to gather specific data that can be put together with the other 4 communities that also receive these pilot funds for various kinds of street medicine, so we can learn about best practices and then expand it in the future in other parts of our state. So exciting and optimistic and really hardworking people that care deeply to try and meet people where they're at and get them connected. So.
Great. With the Drug Crisis Task Force.
Oh, I'm sorry, I forgot to pause before I moved on.
That's fine. Are you expecting any of the recommendations? So you're talking earlier about like the fun problem of having to spend the money, right? So I'm wondering if you've had any sneak previews of some recommendations from the Crisis Task Force that might involve like capital projects or a good way to spend $4.25 million quickly.
Well, the ship has kind of sailed on the alternative response, and the opioid work that we're doing with the Drug Crisis Task Force is kind of a little bit beyond that, or behind that. But I absolutely think that they will want the continuation of social workers to support individuals who are having behavioral health crisis and who need help getting connected to substance use treatment and mental health and peer support. And we can't spend money on capital with the $4.5 million. I mean, you can semi-remodel something, but you can't change the structures of the base or weight-bearing walls, and you can't add a new HVAC system. So there's a lot of rules with this money. But again, I think it's, we also have some of our opioid money that I think that we'll be able to maybe look at that a little bit more comprehensively and see if there are strategies that are recommended that we might want to use those funds for. But more to come. Like, the mayor needs to get those. I think you've been attending, so you'll have a little insight into what they are, and that will be future work for y'all.
Great.
So just the final little update is just to remind you that a little different than our community support side of the house, but the consolidated plan for 2025 through 2029, we continue to do community outreach throughout the summer, where we're gathering feedback about community needs. And then we'll be having a public hearing in August where we'll share those needs that we've heard to see if the public verifies and validates them. Throughout the summer, we're having community development support our staff out at our community events to both try and gain that feedback, and then also kind of having a social work presence sometimes in case there's something that comes up where someone might be having a little bit of a crisis and they need some support, or just kind of do some marketing and advertising that we exist, or they exist. And that is essentially my update for today.
Fantastic. Thank you, Julie. And to your team. I know it's a lot of heart-heavy work, so appreciate it. Yeah. Great. Any questions for Julie? Great. Thank you. Appreciate it. Speaking of the Drug Crisis Task Force, since our next meeting is scheduled for July 3rd and is canceled, would it be too soon for the August meeting to have a update on the findings, or is there maybe need another month to kind of see how things
You know, I
shake
haven't had a
out and-
chance to talk to Mayor Franklin about the report and how she wants to, you know, maybe the two of you even could chat about it to see how she wants to share that report. So I can't, Jennifer, I'm sure will put that on our list of things to ask, but I mean, again, there's going to be a public report. I'm very sure we can share it with you, but I just don't know if we'll have a lot more like next steps yet defined, but
Okay.
just kind of an overview, or if you want it to go to the entire council, you know, so.
Okay.
Yeah, I mean, we had it on the pending list for this committee. I think the idea of like, you know, using this to do the longer briefing and conversation, and then maybe it gets advanced up after that. And whether it's ready in August or there's more time, maybe it's a September thing, but we can talk to the mayor, figure it out.
We asked for, we asked for a brief report, like, we don't want a 125-page report. We didn't want 83 recommendations, you know, so our facilitators have really helped us to keep them narrowed. So that part will be nice, that there won't be so much information to dive through.
Great. Let's find my agenda here, wherever it disappeared to. I was gonna look through the list of future pending items. Maybe the comp plan housing element update to the update would be good and timely. And then also the women and children's pallet shelter, even though it'll be a little bit past the findings. And the, sorry, Julie, you just mentioned the name of the survey, the community
Consolidated plan.
consolidated plan, thank you. Would that be?
Yeah, like the needs assessment, or, yeah, the
Yeah.
results of that.
That might work for August then.
Yeah, we'll certainly want to let you know earlier about the VOA, like, you know, Jennifer can send you an email hopefully tomorrow. Maybe, I don't know. We get, once we
Trying
get
to-
it.
I was browsing our site to try to figure out what's the quickest way I can find that.
I'm sure David will let us know.
Yeah, I like to be first, you know?
Oh, so noted.
But I'm sure David will pass it along, and I'll send it out to council as soon as we have that as well on the women and children's. But yeah, I'll touch base with Yorick and team on the comprehensive plan housing element, and then if there isn't, if it's timely on the consolidated plan, they're doing lots of outreach. Maybe maybe that makes sense. Maybe later, whatever, and. Yeah, and then on the drug crisis task force, I'm sure we can find one of those for August, and then another one that'll help us for September planning, and yeah.
Great. And Councilmember Fossey and I have the tenant protections
Yeah.
work that we've been doing. I'm not sure if it'll be ready to be presented on yet. We can add it to the list. It's great.
good.
Anything else from folks? All right, it's 5:40. We are adjourned. Thanks.